Welcome to another episode of your oral health and prevention podcasts, Smiles in the Air. I'm Celso da Costa, and today with me I have Dr. Karoussis. He's graduated from Dental School of the University of Athens in the 94, and afterwards got a specialization degree in periodontology, as well as honorary master's degree in oral biology. His scientific work, I think everyone knows him. Is a lot of articles, more than 100 articles, Greek international, already done. I cite quite a lot when I'm lecturing, to be honest. It is a pleasure for me. And it has his last publication, Peri-Implantitis, from diagnosis to treatment, that was wrote together with Professor Lang, where it provides a comprehensive overview of the key aspects of diagnosis and treatment of peri-implantitis. Welcome to the podcast, Dr. Karoussis.
Thank you very much.
It
Dr.
is such a pleasure to have you here.
The pleasure is all mine. Thank you for having me here. I really feel very comfortable. I feel good, actually. And it's a good opportunity to come back to Switzerland, a country that I considered as a second home.
Yeah, a little bit from you. Do you spend a lot of time in Bern?
Not a lot in terms of years. I was here for 2 years and I had then the opportunity to go back and forth sometimes. Yeah. But it was so intense, it was so important, and I had the chance to meet great people.
Yeah,
I got a very good education here, and I have a huge respect for the country, for the people, for dentistry of this country, and I'm happy to be here with you. Thank you for the invitation.
No, thank you for coming, because it's been a while that I wanted to talk with you. I always saw your lectures, and I always refer to you as the sweetest person talking about perio.
I'm flattered. Thank you very much.
It's true. It's calm. You share your passion, share your knowledge, but it's always straight to the point, too. And every single time that I see you, you have a smile when you are talking. So this is good. But why this passion about periodontology?
Why this passion? That's a good question. Actually, I'm not sure that I can explain it. When you decide what to follow in terms of what kind of profession will you follow, there are certain things that may act as magnets for a youngster. I would say that even though I love medical studies and I believe that medical doctors do something extremely important, I decided for many reasons, I wouldn't bother you, that dentistry, which is something completely different, but at the same time is at the same field of providing patients a very good level of living, and it can help people a lot. And you can see the results of your work directly. You don't have to spend years and years and feeling uncomfortable and sometimes unhappy that you cannot help people, like in medicine, in some specialties. Yeah. I think we are very lucky to be involved in dental treatments and being able to give patients oral health, happiness, and well-being, feeling, and nice smiles.
Yeah. And you're doing this because you have your own practice for more than 21 years, right?
Yes.
23.
You are right. In my country, we are allowed to work both at the university academically and in private, which actually means that we have to work in our practice in the evening till extremely late.
Long hours, yeah.
Yes, exactly. Usually for an academician in dentistry who is also running a private office, we have to work at least 10, 12 or maybe more hours a day.
Yeah.
That's not so easy when you have also a family and you want to be, a good husband or father or or mother for ladies.
Yeah.
It's not so easy. It's not always easy, but it's such a nice feeling. For me, at least, I would say that the maximum of happiness, professional happiness, is given to me by teaching students at both undergraduate and postgraduate
Yeah.
level. This is what I really enjoy doing it.
And it gives you also another vision, because when you are teaching young minds, but you are also practicing at the same time, so you never lose this touch of the reality, right?
Yes, you're right. But there is a trap here, a disadvantage, because you see different faces, but at the same age, you do not realize that you get older and older. So this is a problem. But I'm joking. It's fantastic. It's very nice.
I don't know if it's a joke, because this week I got like this slap of reality that I said, I was talking about a friend about when I was 18 years ago, what I was 18 years old. And then I stopped for 30 seconds like, oh, this was 18 years ago.
You see?
So it really felt that I was remembered this moment. So I understand. We see these young minds. We don't see the time passing. But also I think you do it because it's a pleasure for you, right? And it's a way to keep us young.
Yes, it is. Actually, a teacher of mine once told me that we teachers teach what we really want to learn. And that's also truth.
That's a nice one.
Because we do know several things, but the more knowledge we earn, the more we realize that there are so many things we have such a little knowledge, or even we do not know almost anything about several things. And this is something that an academician should always have in mind, that we use the knowledge that we have gathered till now to have a basis as solid as possible to build and go further and higher. And unfortunately, sometimes we forget what happened till we got this knowledge, and we take things for granted, or we have some ankylosis and we do not want to accept the evolution and the change, which is something that comes with age usually. Young minds usually are more capable to visualize the future. Let's take, for instance, what happens now with all this computer technology in the field of rehabilitation and prosthodontics, and implant dentistry, all this guidance through computer gadgets. For people in my age and older, it's much more difficult to adapt compared to younger people that are more willing and more educated and more open-minded in accepting all this change. But it's nice. It's nice, and
it helps. But I know what you mean, because I have the same feeling. Is that youngsters they are teach already with it, so it's easier for them. And I call also in terms of my generation, because everything was manual. And in 5 years' time, when I got into the profession, in 5 years, everyone started to digitalize the practice. So everything that I learned in university, I needed to relearn again. But it was easier, the work itself afterwards, after learning, of course. But it took a while. It's like, wow, I spent such time in university learning one way, and now I need to adapt.
Yes, exactly. It's always like this. You need the learning curve, and the learning curve is always the same. What is not always the same is the age that we have and the fatigue that we have gathered and the ankylosis that keep us solidly in the past.
Yeah.
So older someone is, the more difficult it is to adapt and to evolve. But the history and science prove that whether you have to adapt or you will be extinguished.
Yeah, yeah.
So we have to adapt, and this is so nice when someone works in a university environment, because it's what we do. We have to learn the new stuff, and we have to become able to teach everything new to people. But on the other side, I would like to share with you something that worries teachers all over the world, because it's not that easy to transfer the knowledge with a different way. Young people do not incorporate knowledge the way people in my age used to. For instance, a textbook used to be the only source of knowledge. After a while, we started reading also to the international contemporary literature. Then internet came and everything changed. We were able to learn everything in 5 minutes after it was, published on the internet. And now it has been calculated that it's absolutely impossible for scientists to just to read, not to learn everything, just to read all the papers that are published during a month. You have to quit sleeping, eating, doing whatever, because there is no time, and the knowledge and the data are given in such amounts. And even though it's great, it's a bit
overwhelming sometimes.
Yes, sometimes you're right.
I agree with that, because it's like the pace is so fast now that we are getting more information than the one that we can actually absorb.
Yes.
And the problem that we have today, and that's why it's so important to have teachers like you, that is to learn the good knowledge or the good information from the less good information. And sometimes we are bombarding with all these articles and we don't know where to choose, and everyone is kind of so different. Then we need someone like you that was like, okay, this was the method, it was correct, we're gonna go, we take this and we accept this study as part of the review or not. And I think that's what you were trying to do with the book, because people that were here before, they brave the path. So that's why the youngsters, it's so easy for them to learn, because people in the past already saw, oh, this is not good, or this is the good way, let's go for the good way. And then you try to put the knowledge in this book, right? So what was the reason behind it? Like, I want from your own words, and what you think that people need to do with this book, or how they need to be guided by this book.
Yes. Actually, allow me to take a little something from what you said. And one of my favorite sayings is attributed to Sir Isaac Newton. And he said that if we can look far away, it's just because we stand on the back of giants that were here before us. And that's true. Actually, we were taught how to deal with peri-implantitis and peri-implant mucositis based on knowledge that came from periodontology. However, we realized that, and it was not easy, that implants are not teeth.
Exactly.
So we failed in a high extent to achieve such nice results like the ones that we can actually achieve when we treat periodontitis or even gingivitis. Since we are lucky enough to live and work in Europe, because at the other side of the Atlantic Ocean, there was a difficulty some years before to accept that peri-implantitis even existed.
I remember that.
You remember
I remember that.
this period. So now it's a common knowledge, and we have to deal with thousands of cases. And since I was lucky enough to be educated in Bern for a part of my education, where implants actually in Bern and in Gothenburg, Sweden, were the first two places involved in such an extent in implant dentistry. I had the chance to see patients having implants that had been placed years before I went to Bern. And actually my doctoral work had to do with peri-implantitis in a certain extent and history of periodontitis. And I realized back then, more than 20 years ago, that there are some risk factors that have to be found, and we have to deal with these factors so we can reduce the disease. The problem here is that peri-implant diseases are not only a problem of my practice, your practice, or of dentistry. If you figure that at least in the United States and some of the European countries that give the data, yearly more than 10 millions of implants are placed yearly. If you multiply it with 25 years, 30 years that we use implant in a high extent, and if you multiply the result with the percentages of peri-implant mucositis or even peri-implantitis, then we realize that we face a public health problem. Peri-implant diseases is something that we will have to face. And the problem is here, now.
Yeah.
Even if someone avoids to see the problem is there. Even if titanium implants are stopped to be produced and something else is replacing these titanium implants, we still have hundreds of thousands, we have millions of implants and millions of patients in need for treatment. And let me give you some inside information, inside my brain, I mean.
Yeah, that's why we are here. I want to pick your brain.
Actually, I was raised and trained to use mechanical debridement as a step one of an admirable protocol that I have been taught. This protocol is the cumulative interceptive supportive therapy, introduced by two great guys that offered periodontology so much. I'm talking about Professors Mombelli and Klaus Lang.
Yeah.
However, mechanical debridement, which is used even today for treating teeth, might not be so safe when we want to treat implants. Actually, I would change the word might with a more strict one. We should not use mechanical debridement around implants, because I have data to support it, not only data of my own research, but it's internationally available, that unfortunately, if we debride the metallic surface, the titanium surface, with whatever instrument you name it, ultrasonic, plastic, curettes, titanium curettes, copper curettes, brushes for treatment of peri-implant pathologies, then we create a distraction at the surface and we produce particles, we change the environment, we actually introduce peri-implant pathology, and we have enough data to support that there might be particle-induced peri-implantitis. Unfortunately, when we have an inflammation, the pH of the peri-implant sulcus drops to about the number of 3, very acidic environment, which is more than enough to dissolute the oxide layer of the titanium, which means that the surface is not anymore biocompatible.
Exactly, yeah.
And imagine that we get inside this area with something hard enough to grain the surface and harm it even more, which means that we were trying to do something good, and we actually did exactly the opposite of what we were supposed to achieve. And through the years, I was lucky enough, and soon enough, I suppose, to be exposed to the GBT philosophy and this methodology, which is not something different than what anyone would do if anyone would be knowledgeable enough to know the data and use the data in an everyday clinical practice. I mean, the first step is to make a correct diagnosis. Is it correct?
Correct. Yeah.
With the false diagnosis, we should give a false prognosis, which means that we would go to a false or even a dangerous treatment planning, which would cause a disaster. The second step would be to disclose in order to be able to see where the enemy exists, and something even more important. Could you please tell me, of course you will agree with me because we have the same mind about that, but how is it possible for a professional to teach, to assist a patient to perform not oral hygiene, but to perform successful oral hygiene, if the patient does not see where is the enemy? For people at my age and older, especially if we don't use our glasses, it's impossible to see something so small, a small white, substance. Come on. But if you disclose it in my mouth, I will be surprised. And then I will realize the time needed in order to get rid of this film, of this biofilm. And furthermore, it will guide us, use the right way, the right spots, the right angulation to get around the periodontal or peri-implant sulcus or pockets and do our job. The same job that we used to do. But even if I accept, I don't understand it, I don't agree, but I accept someone who says that in terms of treating gingivitis or periodontitis or giving a maintenance care in people with teeth, I can use whatever instruments or devices I used to have 20 years ago. Okay, I see the point and I accept it. However, I cannot neglect the time needed, the easy way to teach the patient oral hygiene, the easy way for me to know that I don't spend time in areas that I shouldn't and spend more time in areas that I should. I could say a lot of things about that, but teeth are not the key subject in our discussion. If you consider implants, and we have data, I have some, I think, nice data also from scanning electronic microscopy in the book that present the destruction of the implant surface or of the titanium surface, because there are also parts of the implant-supported suprastructure or parts of the implant that are accessible even prior to bone destruction. And then you can see in these pictures that if you use metallic or plastic or whatever instruments, you will harm the surface. And even if you are not willing enough to accept the next huge issue of the danger caused by particles, you have to accept that you have achieved to scratch a surface, and the surface energy is higher now, and more biofilm will be and stabilized there, and the danger will increase. Even if you forget everything about the particles, which means that in any case, you have to find a way to do the job without cause any kind of risk or not cause the disease after all.
Yeah, treat without damage further.
You don't damage, exactly. And as far as I have been informed and read and trained and researched, GBT is exactly what I was trying to do even before I was informed about GBT.
About the protocol, yeah.
I mean that every scientist in the world would follow the same things: diagnose, show the patients how to do oral hygiene. Unfortunately, not everyone uses disclosing agents, which is unbelievable, but this is the reality.
Yeah.
And this is what we have to persuade people to start using it.
Don't you think that they don't use it because sometimes we forget as clinicians that we are educators first? Because we should educate the patient how they will maintain this without us. We are not with them all the time.
You're right. You're right. And if I may add, we have not, as a group of people providing oral health, I think that we have not realized how easy it should be to remove all this color from the surfaces of the mouth, because many people still use hand instruments or polishing stuff or even ultrasonic devices, and not the proper use of a combination of air, water, and a certain powder to remove everything nicely, without pain, and actually without causing any harm. This is something I want to say again and again, because for teeth, okay, use whatever you like. I don't agree. I told you what I use, but for implants, if you don't want to be dangerous as a oral health provider, whether you don't do anything around implants, or if you do, use the right methodology. And this is given in the book. The cyst protocol had as the first step of dealing with implants, irrespectively of the state of health, whether the peri-implant area is healthy or under mucositis or suffering from peri-implantitis. The first step is to reduce inflammation, but not via mechanical debridement, which is definitely harmful, but with GBT, which is, in my mind, as is written in the book, the only way to be sure that you will do the job, you will reduce or eliminate inflammation without causing any harm. And then, according to the condition that the practitioner finds around the implant, you follow some other steps, which is, I believe, I hope, nicely given in a didactic way. So there is an algorithm that everybody can or should follow in order to maintain peri-implant health or restore implant health when disease has occurred.
I was inspired here when I was hearing you, because it's exactly what sometimes we look for, is like someone that believe in the well-being of the patient. And you said this multiple times: do not harm, do not harm. Do we underline this multiple times? I think, well, Jack Acid, it said one thing that stay register on my mind since I heard his lecture. This the best implant, and the guy is a surgeon, a French surgeon, one of the best. He said the best implant is no implant at all. And I was like, well, it's true. So why we are placing implants? And I remember 15 years ago that everyone was crazy about implants, that it was the best thing in the world. Why? Because there was a kind of metal, so it's way resistant, so it stays there. You put it once, you are good forever. Today we are shifting. Like, no, listen, it's not the same. Nothing replaces a natural tooth. If you don't have any other solution, okay, good, yeah, place an implant, but you need to be extra careful. And that's what you are saying now, right? We have an implant, you need to be extra careful as a patient that has the implant, but as a clinician that places it, because it's your responsibility to maintain it the right way. And I think the guidelines that you give on the book, I had the opportunity to read it, and I spent a lot of time, and I'm still underlining a lot of stuff on this book that is easy to use. It, well, I wouldn't say that it's easy to use. It's easy to understand because it's well put. It's put it in a way that this is the experience, this is the data that we have from us, but also from the studies that are around the world. So it's proven. So be careful. You are alerting the clinicians. Be careful. It's on your hands.
Thank you for saying that. Actually, in the book, you can see the experience and cases of 20-something years, 25 years. And both of the writers, both Professor Klaus Lang and I, have tried to give everything on an evidence-based concept. Everything which is written there, beginning with the step A, which is equal to GBT protocol, period, till the most complicated surgical procedure that is suggested according to certain guidelines and certain indications. I told you there is a certain algorithm that maybe as a dental hygienist or as a dentist, I would follow to a certain extent, and as a periodontist would go through the modified cyst protocol all the way. But let me ask you something. Let's say that I am a dental hygienist or a dentist. Wouldn't it be really nice if I use this information and reduce at a huge extent the incidence of peri-implant pathology?
Yeah.
In my mind, that's the purpose.
That's a no-brainer.
Exactly.
But again, as clinicians, sometimes we forget the purpose of our profession.
Yes.
The purpose of our profession is to avoid disease.
Not only to treat.
Not only to treat.
You're absolutely
when you
right.
treat, is already too late. So we miss somewhere. And today, as oral health professionals, we are not, and I'm afraid to use this word because a lot of clinicians don't like this, but we are not doing business with health. We are doing business with the disease.
Yes.
And for me, sometimes it makes me crazy.
Yes, I see your point, and I tell you, I agree. Absolutely. Absolutely. The problem here is that several people, including me, everybody, maybe everybody, we have a huge difficulty, and I'm not speaking about dentistry. I'm speaking about everything. The major difficulty that we have is to change.
True.
If you see the relationships that we do several times, maybe we change people that we are with, but they everybody until now had the same kind of character
Yeah.
and the same, special things that annoy us or magnetize us or whatever.
Yeah.
It is very, my late grandfather used to say a Greek saying that said, if someone is born in prison, he will look forward to go back to the prison, which means that if you have a certain way that you have been trained, it's extremely difficult to accept a new way of doing things. And this is something that we have to understand, we have to accept, and we have to try to change. It's not easy. Every shift in paradigms that we have been using until now can prove what I'm thinking. I think that this is correct, and maybe the combination of a good willing among practitioners, especially between universities, private practice, and of course commercial companies that produces technology and innovation. Maybe if we work together, we can provide a win-win situation. I'm absolutely convinced that this is the only way to go ahead.
I agree. A human being is a creature of habits. It's true.
Yes.
And if we are teaching the university how to do it a certain way, then we are convinced that is the best way. Right? So it is difficult to change. I agree with that. And I think we need to, depending of clinicians, have the mindsets. I need to get better 1% every day, not for me, but for my patients. I always said that my grandma, she lost a lot of teeth. My mom, she lost 2. I have 2 restorations for my daughters. I want them to be without any problem.
Great. Yes.
and we are in Switzerland, and my oldest, they have this dentist school control. And in a class of 19 children, she was the only one without caries or any oral problem. And we are living in Switzerland.
Yes.
Okay, we are the land of chocolate. I understand.
Yes,
but even though,
Yeah.
we need to do this for the future of our future generation, of our kids. And this
You're
is what
absolutely right.
make me try to change mindsets. It's not easy. I agree with you.
Yes, it isn't.
Difficult.
It isn't. And let's face it, from the time that a new knowledge comes through the research that bring all new knowledge, till the time that this certain knowledge is used by the majority of clinicians, it might take 20 years.
Yeah. It takes sometimes too long, but it is what it is. And it depends of getting the right knowledge well established in guidelines. That's why I love your book so well. And it was a surprise receiving this book. It was for me because I wasn't expecting when I saw the book, and I was like, oh, wow, this is what we are preaching. This is great. Finally, a textbook that is bringing something.
Allow me please to say that and verify that we do not have no commercial, interest. I don't have shares of the company.
Yeah.
I don't have a reason why to tell anything I don't believe.
Yeah.
But let me tell you, you have produced a methodology, an equipment, and 2 great powders that I can use to do what I want to do my job, and cause something good without harming anybody or anything. I will not promote something. I will never do it in my life. I have never done it. I will never promote something that I have not previously searched or made some research. And we have published data about restoring of biocompatibility of implant surfaces previously exposed to a pocket environment of peri-implantitis.
Yeah.
We do have research also published about the combined detrimental effects of titanium particles and lipopolysaccharides, which actually have a synergistic effect. And we do have data about not harming surfaces with erythritol of the EMS or using whatever else method available at the time. So this is why I strongly believe that step A equals to GBT.
Yep.
And both Professor Lang and I have signed this book in order to share our knowledge, our experience, and we wish that we accomplish this, to share the knowledge with everybody in dental profession, from students to periodontists, because we strongly believe that it's a win-win situation for the colleagues and mainly for the patients and for the improvement of public health. I'm
personally recommending the book to everyone.
Thank you very much.
No, thank you. Thank you for putting so clear on the book. To
and I have to thank Quintessence as well for publishing the book. Yes,
they are always great, right?
Yes.
Every single time that I have some questions to about some of their books, they are always keen to answer, and they are always supporting this independent thinking, what is good, because it brings so much more diversity to dentistry that we need to push forward to, in 20 years, have this as a standard, that's the gold standard. To finish it off, do you have any advice for young people that are starting dentistry? Because you have so much experience, that's for sure they can grab some gold nuggets from you.
I don't know. I have too many things to say. I will tell you the first thing that came in my mind, and this is the first thing I tell to my students back at the University of Athens when I give them the first lecture. I have the opportunity and the privilege to give and be with this age of the people and with these young, brilliant minds. I tell them that even if they have chosen dentistry for whatever reason, which might be prove wrong, they will fall in love with dentistry.
Yeah.
You cannot avoid it.
It's true.
Yes, they will fall in love, and my only advice is to have also personal life, not only professional life, because the most important thing is not a thing.
Yeah.
Is feelings, is family, is all these things that made us what we are in terms of character and personality.
Yeah.
And that's it. I don't have anything else to say. I wish everybody, because of the period of the year, to have Merry Christmas, and I wish for a fruitful and peaceful New Year.
For sure, that's the reason why we are here, to provide smiles. And you said about the feeling, and that's what we are bringing, smiles to people, so they can have a nice end of the year and a good start of the next one. So thank you so much.
It was my pleasure.
It was really a pleasure. Thank you. It was really a pleasure. And finally, I can get it from my bucket list. That was to talk to you in this tête-à-tête, as we would say in French. So thank you for that. So for all the listeners, you hear here from Dr. Karoussis, do not damage the implant. That is the most important. So and we need to praise people like you, like Dr. Karoussis, because they brave the path with their own clinical experience, their own scientific research, and now they are putting everything in kind of a quick guide for you to be already in the next level. And we should be happy because we are at the peak of the knowledge in dentistry and the technology. So we are even better than 20 years ago, for sure. Thank you so much. So if you haven't subscribed, subscribe to our podcast in Apple Podcasts, Spotify, or even at YouTube's, and do not miss the next episode. So thank you. See you soon.